EMT Prometric Questions and Answers. Questions 201 to 225. 201. A young woman who is overdosed on a strong narcotic dry is unconscious, with slow, shallow breathing. As you attempt to insert an oropharyngeal airway, the patient begins to gag. You should next remove the oropharyngeal airway and be prepared to suction the mouth. Remove the oropharyngeal airway and insert a nasopharyngeal airway. Suction the patient's oropharynx as you insert a nasopharyngeal airway. Make sure you are using the most appropriate size of oropharyngeal airway. The answer is A. Remove the oropharyngeal airway and be prepared to suction the mouth. 202. As you are ventilating an apneic patient using the one-person bag valve mask technique, you note minimal rise of the chest each time you squeeze the bag. You should A. Ensure that the reservoir is attached to the bag valve mask device. B. Squeeze the bag harder to ensure delivery of adequate tidal volume. C. Suction the patient's mouth for 15 seconds and reattempt ventilations. D. Evaluate the mask-to-face seal and the position of the patient's head. The answer is D. Evaluate the mask-to-face seal and the position of the patient's head. 203. After an adult cardiac arrest patient has been intubated by a paramedic, you are providing ventilations as your partner performs chest compressions. When ventilating the patient, you should A. Deliver 2 breaths during a brief pause in chest compressions. B. Deliver each breath over 1 second at a rate of 8 to 10 breaths/min. C. Hyperventilate the patient to maximize carbon dioxide elimination. D. Deliver each breath over 2 seconds at a rate of 12 to 15 breaths/min. The answer is B. Deliver each breath over 1 second at a rate of 8 to 10 breaths/min. 204. When ventilating a patient with apnea with a pocket mask device, each breath should be delivered over A. 1 second. B. 2 seconds. C. 3 seconds. D. 4 seconds. The answer is A. 1 second. 205. A 60-year-old woman presents with acute respiratory distress. She is alert and oriented, but restless. Her respiratory rate is 26 breaths/min with adequate chest expansion and clear breath sounds. What is the most appropriate method of airway management for this patient? A. Supplemental oxygen with a non-rebreathing mask. B. A nasopharyngeal airway and assisted ventilations. C. A nasopharyngeal airway and supplemental oxygen. D. A nasal cannula with the flow meter set at 4 to 6 L per minute. The answer is A. Supplemental oxygen with a non-rebreathing mask. 206. A semi-conscious young man has shallow, gurgling respirations at a rate of 10 breaths/min. Initial management should include A. Suctioning the oropharynx. B. Inserting a nasopharyngeal airway. C. Initiating positive pressure ventilations. D. Applying 100% oxygen with a non-rebreathing mask. The answer is A. Suctioning the oropharynx. 207. Which of the following airway sounds would most likely indicate a lower airway obstruction? A. Stridor. B. Crowing. C. Gurgling. D. Wheezing. The answer is D. Wheezing. 208. Which of the following assessment findings would most likely indicate cardiac compromise? A. Tachypnea. B. Tachycardia. C. Irregular pulse. D. Sudden fainting. The answer is C. Irregular pulse. 209. A 50-year-old man presents with crushing chest pain of sudden onset. He is diaphoretic and nauseated. You should A. Obtain baseline vital signs. B. Apply supplemental oxygen. C. Ask him if he takes nitroglycerin. D. Perform a focused physical exam. The answer is B. Apply supplemental oxygen. 210. As you are assessing an elderly man who is complaining of chest pain, the patient suddenly loses consciousness. Your first step should be to A. Attach the AED. B. Open the airway. C. Assess for a pulse. D. Assess for breathing. The answer is B. Open the airway. 211. Freshly oxygenated blood returns to the heart via which of the following blood vessels? A. Aorta. B. Vena cava. C. Pulmonary vein. D. Pulmonary artery. The answer is C. Pulmonary vein. 212. Which of the following statements regarding the automated external defibrillator is true? A. It should be applied to patients at risk for cardiac arrest. B. It will analyze a patient's rhythm while CPR is in progress. C. It should not be used in patients with an implanted pacemaker. D. It can safely be used in children between 1 and 8 years of age. The answer is D. It can safely be used in children between 1 and 8 years of age. 213. Nitroglycerin possesses which of the following effects when administered to patients with suspected cardiac chest pain? A. Vasodilation and increased myocardial oxygen supply. B. Vasodilation and decreased myocardial oxygen supply. C. Vasoconstriction and increased cardiac workload. D. Vasoconstriction and increased cardiac oxygen demand. The answer is A. Vasodilation and increased myocardial oxygen supply. 214. You arrive at the scene of a 56-year-old man who is not breathing. Your initial assessment reveals that the patient is pulseless and apneic. The patient's wife tells you that her husband suddenly grabbed his chest and then passed out. As your partner confirms cardiac arrest and begins 1 rescue or CPR, you should A. Notify medical control. B. Insert an airway adjunct. C. Prepare the AED for use. D. Obtain a sample history. The answer is C. Prepare the AED for use. 215. You arrive at the scene of a 56-year-old man who is not breathing. Your initial assessment reveals that the patient is pulseless and apneic. The patient's wife tells you that her husband suddenly grabbed his chest and then passed out. When performing 2 rescue or CPR on this patient, you should A. Slowly compress the chest to a depth of about 1 inch to 1.5. B. Not attempt to synchronize compressions with ventilations. C. Have your partner pause after 30 compressions as you give 2 breaths. D. Continue ventilations as the AED analyzes the patient's cardiac rhythm. The answer is C. Have your partner pause after 30 compressions as you give 2 breaths. 216. You arrive at the scene of a 56-year-old man who is not breathing. Your initial assessment reveals that the patient is pulseless and apneic. The patient's wife tells you that her husband suddenly grabbed his chest and then passed out. After successfully resuscitating the patient, you provide immediate transport. While en route to the hospital, the patient goes back into cardiac arrest. Your next step should be A. Tell your partner to stop the ambulance. B. Begin CPR and proceed to the hospital. C. Contact medical control for further advice. D. Analyze the patient's rhythm with the AED. The answer is A. Tell your partner to stop the ambulance. 217. A 45-year-old woman calls EMS because of severe chest pain. When you arrive, she advises you that she has taken 2 of her husband's nitroglycerin tablets without relief. What is your most appropriate course of action? Attach the AED, administer 100% oxygen, and contact medical control for advice. Apply supplemental oxygen and transport the patient to the hospital without delay. Call medical control and request permission to assist the patient with 1 more nitroglycerin tablet. Obtain the patient's blood pressure and administer 1 more nitroglycerin tablet if her blood pressure is greater than 100 mm of mercury systolic. The answer is B. Apply supplemental oxygen and transport the patient to the hospital without delay. 218. Cardiac arrest in the adult population most often is the result of A. Myocardial infarction. B. Respiratory failure. C. A cardiac arrhythmia. D. Accidental electrocution. The answer is C. A cardiac arrhythmia. 219. The chest pain associated with cardiac compromise often is described as A. Sharp. B. Stabbing. C. Pressure. D. Cramping. The answer is C. Pressure. 220. As you are attempting to resuscitate an adult man with cardiac arrest, you receive a no-shock advised message from the AED. What should you do next? A. Continue CPR. B. Check for a pulse. C. Assess for breathing. D. Reanalyze the rhythm. The answer is B. Check for a pulse. 221. The myocardium receives its blood supply from the coronary arteries that branch directly from the A. Aorta. B. Vena cava. C. Left atrium. D. Right ventricle. The answer is A. Aorta. 222. The EMTB should consider performing 2 minutes of CPR prior to attaching the AED to adult victims of cardiac arrest when A. The arrest is caused by a traumatic injury. B. The patient's cardiac arrest was witnessed. C. The call to arrival time is more than 5 minutes. D. The patient has known coronary artery disease. The answer is C. The call to arrival time is more than 5 minutes. 223. Which of the following are side effects of nitroglycerin? A. Nausea. B. Anxiety. C. Headache. D. Hypertension. The answer is C. Headache. 224. Which of the following patients would be the best candidate for the administration of nitroglycerin? A woman who has taken 3 doses of prescribed nitroglycerin without relief of chest pain. A woman with chest pain, prescribed nitroglycerin, and a blood pressure of 102/76 mmHg. A man with chest pain, a bottle of expired nitroglycerin, and a blood pressure of 110/80 mmHg. An elderly man with crushing chest pain and a blood pressure of 90/60 mm of mercury. A woman with chest pain, prescribed nitroglycerin, and a blood pressure of 102/76 mmHg. 225. Which of the following chambers of the heart has the thickest walls? A. Left atrium. B. Right atrium. C. Left ventricle. D. Right ventricle. The answer is C. Left ventricle.